have anything to do with accountability. So this morning I woke up and I had an email from somebody who I talked to maybe months ago who they were waiting for me to reach back out to them and help them figure out what they're going to do as far as the health plan for 2026. Now today is the 20th. Shout out to my big bro. It's his birthday today, so please wish him a happy birthday, man. But back to this person who sent me an email this morning. If you guys have been following and watching the channel, you know that I started early, even before open enrollment began in November on the 1st. And I said, hey, this year is going to be very different. There's going to be a lot of changes. The premiums are going up, subsidies are going down, networks are changing, a lot of things are happening. So I wouldn't recommend that anybody waste time. I actually want you to start shopping now. Start putting all the different options together, because the time frame that you have to make that selection has even gone down. It's shrunk. And some people took heed, some people kept on doing what they were doing. This particular person that sent me an email this morning was somebody that I talked to, again, maybe months ago, in regards to finding them a plan. And set up an appointment. Sometimes they never show up for the appointment. I'm not going to force anybody to show up for an appointment that's supposed to be helpful and beneficial for them. I'm just here to provide the information, the direction, the knowledge, so that you can get it and apply it how you see fit in your own specific situation. And that's the problem that I've noticed. That's where the lack of accountability comes in. Even though it's your situation, right? And the information that I want to share with you benefits you, so many people are too busy. They don't have the time to invest in getting the information so they can actually see the results and make things happen. I knew that there's going to be, I've missed the, you said, start shopping early, leave all the warnings before this. Here we are. So if you're watching, if you're somebody who's looking to make sure that you have coverage for 2026, I just want to say that you're not out of time. You're not out of options, unless you really want to have traditional insurance. If you're looking for an alternative, like most people have been, but are just scared because that's all they've been using is traditional insurance, then there's options. If you're in a state like California, where I am, there's still more time. But for majority of the country, if you're in a state that uses healthcare.gov to do your shopping for your health plan, it's over, right? Has come and gone. And if you haven't put in an application by now, then it's not going to work out for you again, unless you have that qualifying event. I'm in California. So again, in California, we have till the 31st. Majority of the country had till the 15th in order to have that January 1st start date. Now, there's other options that I've said are available, but the people looking strictly for traditional insurance, number one, you're going to pay more. Number two, you have less time to make that decision on what plan that you want. And you want to make sure you have your doctors in network, your hospitals or facilities that you want to see. You want to make sure all that's in network. There's a little known way that people have been saving money and getting all their needs, their medical needs, handled and taken care of without all the stress. And it has nothing to do with insurance. But most people seem to be looking in the wrong place for this thing because it's not insurance, right? Most people are searching in insurance marketplaces for this solution. And I've already put information on several videos that you guys can check out. First of all, use the calculator. Compare what you're paying or what you were paying. If you missed the enrollment period and you feel like you're stuck in that, may be something that you don't want to deal with for 2026, again, there's still an option. But if you're stuck on having insurance be your solution, then you might want to make sure that you have a qualifying event so that you can actually sign up. Otherwise, it's not going to happen. The alternative solution, again, is where people are saving money, getting the care that they're actually looking for. So the system, the healthcare system in America, a lot of people complain and say that it's a broken system. I just want to say, if you're watching, the system actually is working perfectly. It's not broken. It's designed to be confusing. It's designed to be uh to make profit, right? And sometimes I hear people say it's profit over people. That's exactly the design, right? So don't think that insurance companies are your friend and they're there to, help you get the best care, the best prices, and the open networks that you might be looking for, right? It's not how it was designed. So there are other ways. That's my point in sharing these videos with you. I've been working in the insurance industry since 2017. Started off with Allstate, where we did no health insurance whatsoever. And since then, moved on to different roles, different positions where I've been working a majority of the time on the healthcare space. And what I found, like I've said before, a lot of you guys that may be watching, a lot of you guys that may be paying for insurance have no clue what a deductible is, have no clue what an out-of-pocket max is, have no clue what co-insurance is. And these are simple things that, in my opinion, everybody needs to know. It's like one of those subjects that we never learned in school, but when we get out, if we want to say that we're an adult, we better know what these things are because they affect every single day. But if we're not paying attention because it's just, it's not something that I want to worry about, then that's fine. Somebody else will worry about it for you, and you're not going to like the decisions that they might make. But if you're not worried about it for yourself, then what do you expect to have happen, right? And that's where I'm talking about accountability. Don't just be accountable on the things that you want to be accountable for. Be accountable for the things that sometimes you're not excited about the result. And a lot of times when you talk about healthcare, people are like, oh, Obamacare this, or, Trump this, or whoever. That's all fine. That's good and great, right? People make policies, people vote for things, things happen. What I know is that we all have choices, and some people haven't even taken the time to learn about the options, to learn about the choices that they could make, because they're too busy pointing the finger and saying somebody else is the reason, somebody else is the problem, something else other than me, even though I haven't taken the time to evaluate and figure out what I want. Right? If I asked you, hey, what do you think about the state of healthcare today in the country? Most people will say, "Oh my God, it sucks. It's not good. It's not great." But if I said, "Hey, what would you do if you had the power to make it great, to make it the way that you felt it should be? What would change?" Right? That's the problem. Most people have to sit down to think about how does it work, where's it broken, and where are the fixes necessary? And if I had a magic wand to just wave, what kind of changes would I want to see? Right? Because I think most people would want things like no network restrictions. Hold on, I work in billing for a hospital and it's unnecessary confusing. Explain co-insurance and doses. Man, I'm with you. I understand the confusion that people are going through, my friend, and it's crazy. And that's part of the design. If people don't understand really what they're paying for, and they're just paying for it, majority of people are paying for just in case, right? People are paying for just in case something goes wrong, then, I have this insurance in place. And one of the things that I started realizing is most people never use that just in case. But we all know in insurance, hey, it's better to have it and not need it than need it and not have it, right? I'm sure an insurance guy came up with that saying. But anyway, it's true. If you are in a situation where you're paying for just in case, I personally would rather pay a lower amount for that just in case. I'd rather pay a lower amount for the just in case because if you think about it, for a lot of people, they've been paying for coverage for years and years and years. Car inspections in Texas, you have to get yearly. It's pointless. Yeah. It's like getting your smog, right? You got to get that smog done before you can register the car. You don't get the smog done, you can't get the registration done, you can't drive the car. Everything's tied into making sure that you do these extra things. And some people don't understand why, but it's part of the process. Trust the process, they say. Trust the process. But anyway, healthcare is a different animal, it's a different beast. And one of the things that I've been thinking about is how can people really start taking more control of the decisions when it comes to their health. And it just boils down to accountability. Here's one of the things that I've been talking to people about that I'll share today. If you have a doctor, whether it's a primary care or a specialist that you see, I would think, I would assume that you would want to tell your doctor how you feel if something's going wrong and have that doctor listen to you and maybe take some of the things that you're saying and figure out how to give you a solution to that problem. And sometimes some people have an idea of, if I'm somebody that hates to take medication, for example, and maybe I like to do more holistic and naturopathic stuff, I might say, hey, doc, do you have any, recommendations that you can give me where I don't have to take a prescription or medication if that's what they're recommending? That conversation right there between you and your doctor, most people don't want to have that conversation. Why? Don't ask me. But this is where accountability comes in, right? Because remember, this is a medical practice. A lot of these physicians, specialists, whatever, they're practicing. So there's no guarantee that they know exactly what they're doing, especially being that they're seeing several different patients, and all these patients have different body types and things of that nature. So you have to just understand that for you, for me, we have to be our own advocates. And if your doctor that you've been seeing, I don't care how long you've been seeing it, because sometimes people attach the time that they've been with a specific individual and they make it like, you know, I can't break this relationship because I've been with them for 20 years. Well, what if in 20 years they haven't been doing the best for you and your health, but you've just been so comfortable with going to them for 20 years? Now you feel like you can't separate yourself. It's almost like you're married now. We've been together for 20 years, but here's a doctor down the street that actually will listen to you and maybe use some of the natural, holistic things that you might be interested in that your doctor for 20 years might not necessarily be into or promote. But sometimes some people are open-minded and they're like, you know what, I'm going to try this doctor or try this solution because I'm open to finding the solution to the problem that I'm facing. And they've honed in on finding a solution, and that's what it is. So right now, I think there's so many people that are looking for a solution for a better healthcare system. And what I found is if you're looking for a better solution for the healthcare system that we have in the country today, most people shop and look for traditional insurance. Maybe the system is a problem. Most people shop for plans, but they're not shopping for different systems that can provide healthcare. And I've said this before, I'm saying it again. Traditional insurance does not equal healthcare. There's other ways to get your healthcare needs met outside of traditional insurance, right? Traditional insurance works for some people. A lot of people complain about it, but the sad part is they don't realize that there's other solutions. So it's almost like shopping for something that you need, but the markets don't have exactly what you need. They have options that aren't quite as good, but they're similar in certain ways. And every year they increase prices. So you end up paying more, but what you're getting is actually diminishing in value. Doesn't make any sense, but some people feel like that's the only market that has shop. So my goal is to let you know that there's other alternatives that you can take advantage of and get the care that you need, but you have to be willing to put in some of the work to do the research to make sure that you understand what your needs are, what you might be getting from a traditional insurance plan at this time, and then what the alternatives are for you that you could take advantage of, and then compare. It's simple, but sometimes people have too many other important things going on to invest a little bit of time to get the information. 15 minutes, man. This is longer than I expected. Anyway, I hope you guys are doing fantastic. Keep on pushing. If I can help anybody in any way, shape, or form, I'm here for it. But I don't read mine, so let's keep this conversation going in the comments below.